Two Auckland women have lost their unborn babies after contracting measles. Auckland health authorities have been giving details of the complications suffered in the outbreak. More than 1,300 people have now contracted the disease in the country's largest city this year, the most since the 1990s. Rowan Quinn reports.
5 pregnant women have been hospitalised in the latest outbreak. The Auckland Regional Public Health Services Senior Medical Officer of Health, William Ranger, says 2 of them very sadly lost their babies. They were in their second trimester. Dr Ranger says though not all unborn babies are affected if their mothers contract measles, there are risks.
Complications in pregnancy due to measles is known to occur, and it can result in fetal losses, miscarriages or low birth weight.
However, health authorities say they don't want to cause panic and the risk of a pregnant woman catching measles is low. Dr Ranger says most are tested for rubella when they first see a doctor or midwife, and if they're immune to rubella, they're very likely to be immune to measles. But he understands many will be concerned.
If there's some doubt about their immune status, they can then be offered a blood test to find out definitively about their measles immune status and be provided with advice accordingly.
Public health doctors have been looking into the complications suffered by patients in the latest outbreak. The Health Outcomes Director for Waitemata in Auckland DHB's Karen Bartholomew says the hospitalisation rate has been much higher than expected, about 36% of cases. She says in other outbreaks and overseas it's usually about 10%. Dr Bartholomew says that may be because kids under 5 have borne the brunt of the disease.
The hospitalisation rate was much higher for those aged 0 to 4, which we did expect, and it's 52%, so certainly much higher.
She says young children are at greatest risk from complications and they're still the priority for immunisation. Dr Bartholomew says the most common complication for all patients has been pneumonia, with 65 people admitted to hospital. A further 3 had suffered encephalitis or inflammation of the brain. She says it's too early to say whether any of those patients will have long-term effects from their conditions. Dr Ranger says health officials are hopeful the disease may have peaked, but it's too early to say for sure.
The highest number of cases in a particular week was about a month ago. That's reassuring, but let's look at another month's worth of data and see if we are either flat or actually decreasing.
Dr Ranger says it's possible there could be a spike after people move around in the school holidays, which finish on October the 13th. I tāmaki makaurau mō te hōtaka o te ahi ko Rowan Quinn DNA.